Yeah, so my initial interest in University of Chicago was ironically actually not just because of the neurology program, but because of the ethics department here at the University of Chicago. Um, they have a world-renowned ethics department and actually offer an ethics fellowship here that a lot of residents and other attendings and healthcare professionals participate in. When I was interviewing here, I fell in love with the neurology department mainly because of the people, and I was surprised and thrilled to learn on my interview that you can actually do the ethics fellowship here as a part of residency with your elective time. When I met all the other residents here, learned about the top-notch neurology program, and found out I was also going to be able to potentially focus on something else I'm super interested in, academic ethics. This program just completely shot up the list for me in places that I wanted to attend.
I really love that we opened a trauma center and that we have all this exposure to ICU. Despite the fact that I'm going into dementia, it actually has given me this interest in ICU dementia. So there's actually something in trauma and ICU for everyone.
So I like that it was a very well established program, and I also like that all the people that train here, they seem to end up here. I like the sense of family type of relationship that you develop with your attendings and mentors.
So I did a sub-I here in my fourth year, and I really loved how the seniors taught the junior residents, and I also liked the camaraderie among the PGY2s who are going to be my seniors. And in choosing a residency, I also wanted to go to a program that served an underserved population, so U Chicago checked all those boxes.
Basically, I picked the university because it has a very strong neuro ICU and stroke departments, and the number of attendings that we have is not huge amount, but it's also not small. So you kind of had this opportunity to be directly involved with each of them and know them very well, and learn directly from them.
Actually, the primary reason why I chose U of C was actually the residents themselves. So actually, after meeting them during the interview season, I noticed how cordial they were, how very friendly they were, and how the resident life was just amazing. I would say the biggest thing when it comes to choosing a residency program is just the mesh work that you get from meeting with other residents. Fortunately, during this COVID-19 pandemic, that might be quite difficult, but obviously I can say from experience, and from the experiences that you will have as well, that just interacting with the residents themselves are just the best way to getting to know the program.
Well, I chose the university because of the fact that I thought I can get the most exposure to all the different types of neurologic diseases and syndromes that are available. And at the same time, just talking to the faculty and the residents, I thought this is a great group to be with. Everyone seemed so nice and got along so well with each other.
I like working at the South Side, and I do like the autonomy we have because I think we have a good balance of making decisions on our own, but still having supervision whenever we need it.
One of the things that I like the most is I think we get a lot of autonomy. So we kind of act in a way when we are seniors on the floor as attendings. We get to decide things. Obviously, we discuss with the attending, but we get a lot of autonomy to decide what to do with the cases that we get during the day, and that kind of prepares you a lot for becoming an attending and for the future.
I think the biggest strength of our residency program is the residents. I'm really lucky to have the co-residents that I have. We have a great group. We all really look out for each other. We're always covering shifts for each other if somebody has something going on, weddings, family events, things like that. And it allows all of us to not miss important things, and then also get a lot done and work together and have a good time while we're here.
There are many things actually I love about the residency program. I guess the first one is the diversity of patients that we get to see here at U of C. So The thing that you'll realize in neurology residency is that it's front-loaded, which means that there are more exposure to patients during the first 2 years, namely the second year of your residency. And I like that because you get to have a wide exposure of patients, whether you're in the ICU, you're on the floor, whether you're in clinic, you get a wide exposure of patients. And I think that is something that's very important to have in the first year as a neurology resident. So I really love that about U of C because they definitely expose you to a wide array of patients. I think the second one is definitely the residency program itself. So our program director, Dr. Lee, our assistant program director, Dr. Elishiva Coleman, they're all very, very supportive of their residents, and I can really open up to them about what's going on, and not just professionally, but also personally as well. So I think that's, and obviously Marla Schofield, our program administrator, is just fabulous in taking care of us.
So I like how diverse the population is and all the cases that we are exposed to. I also like that like for example, I've never had the experience of seeing patients with like trauma before, and that's something that we're getting experience in our neuro ICU. So that's like something new in at least my experience. And yeah, we get to see all like very good cases, and I like when we are like also the second opinion type of providers, that we get patients that refer to us just to try to start the workup in a patient that is a puzzle. I like that a lot.
I think a lot of those things that I was interested in the beginning remain. I like the relationship that I have with my colleagues. It's very nice working environment. The people that our patients, basically the population, it feels like we are making a difference in their lives, because a lot of them come here in like very bad states of health, let's say, and you make quite some changes in their lives.
The main thing I like is my interaction with the other residents. I feel like we all help each other out. At the same time, interaction with the attendings as well. I feel like they listen to us and we listen to them, and it creates a collegiate atmosphere where you do learn as much as you can from the attendings. And I feel like the program itself just listens to what the residents have, any concerns.
Well, I really love the attendings here, actually. They do really great teaching, and they're really personable and easy to talk to, and if you need advice, you don't have to go through this hierarchy of going through senior residents to chief residents to the attendings. You can talk straight to the attendings, and they're happy to help out.
What I think that makes us very unique here is that we get a lot of autonomy. I think, and I'm learning this as I grow in the residency program, that our attendings work with us almost like colleagues to an extent. They teach us and they teach us how to do things, but they really respect our opinions. We get a lot of autonomy to make treatment decisions when seeing consults in the emergency room, on the floors, and with our patients. We have a sense that really the patients on our services are our own, and we're in charge of them, which really enhances the learning. And that's also true in the clinic. We have continuity clinic every week, and we're able to see the same patients over and over throughout our entire residency program. Our attendings make it such so that we really feel an ownership and are able to develop a relationship and help make treatment decisions and form a close bond with those patients.
I think the third thing, again, is just the amount of teaching that you get down in here, and research. U of C is namely an academic institution, and it's well known for that, and there's just a plethora of opportunities to do research and the learning opportunities that you get from seeing patients in clinic and in the inpatient side as well. So I think that standard that University of Chicago holds definitely holds in the neurology residency program.
Yeah, this is a tough year. I encourage all of you to choose a program where you think is a good fit for you, and to use all of the tools that are being provided to help you make those decisions. I'm very satisfied with my choice to come here, and the main reason is because of the people who are here, both my co-residents. and the faculty who make up this place. If you have any questions, please reach out to us and we're happy to answer them.
Yeah, so I think definitely very strange. I agree with that. And I think out of the strangeness, a lot of creativity came out. So there are different ways about learning about program. I think the internet, social media is ramping up. So really try to maximize that whenever you can. And I think people are more open now to just getting reached out to individually. So seek out some advice from people, and just cold contacting people is a good idea.
During your interview, try to pay attention to the way the residents are interacting with each other and with the attendings. I think it says a lot about the program and the cohesiveness of the program, and you'll see that we all really like each other here, and it helps the work environment a lot.
To someone that is considering U Chicago, number one, you'll get all the experience that you need in your neurology training. You'll see all the cases that are sometimes only like described as case reports. You'll get to see them here. You'll have very good teaching with the residents, and also the attendings are very well involved in our learning. So I would say give it a shot. It's worth it.
I think my main advice is it's hard to get a great feel of the programs when you're not actually there, but I think you can get a good idea when just talking to the residents and talking to the people in the interviews. Usually you can pick up on subtle signs and how they feel about the program, and usually they'll show you if they like the program or not.
One of the things I would say when searching for a residency program, and obviously speaking from experience, I think the things that most people look for are whether it's a prestige in the program, or whether it's where it holds in the U.S. World News Report, and those are okay, those are fine, but I think the three main things that I found out that was the most important things to look at when evaluating your home for the next 3 years, next 3 to 4 years for a residency program is how well the residents are in terms of their wellness, and I can truly say that our wellness here is top-notch. How well is your learning sort of not only capabilities but availability, which I can also say is quite there's a lot of learning opportunities here, and obviously how the program itself is in terms of how our program director, our assistant program director, our program administrator is, because at the end of the day, these are the folks you're going to be interacting with for 3 years of your life, and you're going to be interacting with them 24/7, and getting to know them and having a good relationship with them is very important. And I can say from just a couple of months into the program that developing a relationship with them is so easy, and it's one of the best things that I love about the program, how everyone is super approachable and is willing to take care of us when there's some difficult times ahead, of course, especially in this COVID-19 pandemic.
I would tell them that this is a program that is very inclusive. You have a lot of residents of different backgrounds that are here. Also, we have very high numbers of patients, so you get exposed to all types of diseases, so you get enough exposure during your training. Also, the communication with the attendings is very good. They serve as good mentors, and they help us guide us throughout all this process.
I would say one of the things that we have amazing hospital. The installations here are very nice, and something that you're not gonna be able to see, but everything is very nice, and especially with not being able to have dinners and meeting the people. So the environment here is very good, nice. We are all friends, so it's something that you're probably not gonna see with the Zoom meetings. And I experienced myself when I interviewed for my fellowship through Zoom for a stroke. So I was not able to kind of gather information. So this is one of the things that is good that they know.
Find me if you have any questions. I'm at Twitter, at Neil Perez.
Just good luck with the application process, and wish you the best.